Hi team, welcome to the Kindness, Curiosity and Comfortable Shoes podcast. My name is James McFetrich and this is an ongoing toolkit for all healthcare staff. Whether you are a porter or a paediatrician, a domestic or a driver, clinical or non-clinical, just starting or just finishing your work in healthcare, this podcast aims to give you some useful thoughts about working for this amazing business to get you through your day. This episode focuses on kindness, and brilliantly, the week before I've been recording this, the General Medical Council mentioned kindness in their revamped Good Medical Practice as part of making sure that doctors create respectful, fair and compassionate workplace for colleagues and patients. To me, it's slightly worrying that it's not been in the Good Medical Practice guidance before. But anyway, there it is, literally in the week that I am recording the podcast. It's funny, isn't it? Because kindness is so integral to working in healthcare, especially if you're facing patients. You'd think that would be a very natural part of being in that caring environment. And hey, when we interviewed for jobs, often that classic question, what draws you to this profession? What do you think you can bring to it? It's because we want to help people and we want to be kind to people. If you look at some of the stuff on social media about medicine or the NHS, and it's very easy for it to deteriorate into people slating each other, slating the care that they may or may not have got. And people try and rally against that by, hashtag be kind, to make sure that we remember it's really important to be kind to each other. Yes, we can improve our services. If you look at anything in detail, we can improve, but that's no reason to be rude to others. But isn't it astonishing that we need that reminder to be kind to each other? I guess it's very easy on social media when it feels like you're not communicating with a real person. But even in real life, we see that. We forget about the humans that we are talking to and the difficulties that they may be going through. And they need us to be kind. We need people to be kind to us. And in any stressful job, as I've said previously, in healthcare, in the NHS, it is stressful work. It's even more important to remember to be kind. And you can get such a powerful response to a very simple act of kindness. I think back to a night shift I was doing a couple of years back. It was fairly hectic in the emergency department. I was the sole consultant there, in fact, the sole consultant in the hospital, and got to that stage about 3-4 in the morning where things were just starting to calm down, had a bit of control of what was going on. And the nurse in charge, lovely guy called Rich, he turned to me and we looked at each other and he just said, "Mate, do you want a cup of tea?" And I've had more stressful nights. I've definitely had busier nights, but that meant so much to me that he knew exactly what I needed at that time. For those of you who know me, I do love a good cup of tea, but for me, it's very much a social thing. I like holding it in a nice mug. Having tea at work just feels a bit wrong because it doesn't give you that sort of relaxation. I'm not a coffee drinker, so I don't really drink drinks for the caffeinated hit. But at that moment in time, God, it was just what I wanted. And he was busy as well, but just a couple of minutes, just that he acknowledged that would be helpful to me. And he went and made me a cup of tea and we just sat down for a couple of minutes and had a bit of a chat. And that simple act of kindness meant so much to me and absolutely helped me get through the rest of the shift, but it also helped our relationship. Consultant in charge of the emergency department, nurse in charge of the emergency department. We clearly need to get on very well, and it just helps to form those strong bonds that you need to be able to work in that environment. And it is really important. Kindness is so much more than just being nice to each other. It does help us work better together and communicate better. And believe it or not, there is really good evidence that it actually improves patient outcomes if we are kind to each other, and clearly to patients as well. So there's another emergency medicine consultant, a guy called Chris Turner, and he heads up the Civility Saves Lives group. And they've got loads of information and links to research on their website about being kind, being civil to each other. And he absolutely demonstrates it's not just nice to be kind, but according to Chris, it really creates that atmosphere of trust that allows people to ask for help. And for me, that's so important for patients, clearly. If they want help, we don't want patients to feel embarrassed or that they're not going to get listened to. They need to be able to ask for help if they want it. And the same for staff. Certainly in the areas of work I've been in, we run a very flat hierarchy, but it can still feel difficult to ask for help if you feel you're talking to someone more senior than you. But just through being kind to each other, it does give that atmosphere that it's okay, we can talk to each other, we can trust each other. Sometimes it's difficult to know, what does it mean to be kind? What are we actually doing to be kind? But it can be something very simple, very straightforward, simple as just making eye contact, smiling, asking how you're doing today, hopefully perhaps going a bit deeper if you just get the standard, yeah, I'm fine response. But now, how are you really doing today? Could be holding the door open for someone, could be helping someone out with some work that they're doing if they're struggling with. It doesn't need to be anything too deep, just to help that communication and help that teamwork. So my challenge to you, what are you going to do as a result of listening to this? Maybe you've not thought about kindness in this kind of way before, because it feels like we all should do it. It should be fairly straightforward, shouldn't it? So just have a think, what spontaneous act of kindness have you undertaken recently at work? And if you can't think of one, what are you going to do next time? How are you going to be kind to others, to your colleagues, and to your patients? Thank you for listening today. Let me know what you thought about this episode. I am on @JMacEducation on all the socials, and there are links in the show notes for anything that we've talked about today that may be of interest or further reading for you. I'd be really grateful if you could rate, review and subscribe. And most importantly, if you found this helpful, please tell your colleagues about this podcast. So please take care of yourselves out there. You are doing a great job. And remember, be kind, be curious, and don't forget your comfortable shoes. Thank you to Shekinah Studio for the music downloaded through Audio Jungle. Thank you to Beth for the artwork and the photo produced through Canva. And thank you to Buzzsprout for hosting the podcast. The Kindness, Curiosity and Comfortable Shoes podcast is a JMac Education production.